Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had.
Hi everybody, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Our series on cannabis continues, and now we're going to discuss more about cannabis and its dental considerations. What do we need to know about cannabis, Viola? Well, let's face it, your patients use cannabis. They use cannabis to take the edge off. They use cannabis because they think it's going to treat their pain. They use cannabis because it's going to treat their dental anxiety. They use cannabis. And cannabis can have an effect on both their systemic health and their oral health. And so that's what we're going to focus on in this episode. What type of effects does cannabis have on oral health? Well, even the ADA will tell you that it's thought that cannabis is associated with a poor quality of oral health. But it's a little sketchy because we don't really know what kind of cannabis you're using. So if we focus on smoking cannabis, for example, or vaping cannabis, for example, we could say that, the use of cannabis is frequently complicated by concomitant use of alcohol and tobacco. And if you combine cannabis smoking or vaping with tobacco use, of course, smoking tobacco cigarettes, and use of alcohol and even other drugs, that can lead to a poor quality of oral health, but it can also lead to what? Just poor overall oral hygiene practices. So yes, cannabis, when it's associated with the use of other substances, can definitely cause a poor quality of oral health, again, especially tobacco. But keep in mind that cannabis on its own can cause a poor quality of oral health. Forget combining it with tobacco and alcohol. Cannabis can cause xerostomia, okay? And cannabis can make you crave carcinogenic foods and drinks and snacks. Well, to a dental hygienist especially, that means what? Recipe for caries, yes? Absolutely. So right there, just on its own, cannabis has been linked to a poor quality of oral health. Plus, also what? Pathologies, right? Cannabis, smoking cannabis especially, is associated with similar oral pathologies as smoking tobacco, right? Including things like leukodema. But remember that cannabis on its own, not including tobacco, smoking cannabis can cause things like gingival enlargement, erythroplakia, hyperkeratosis, especially vaping, because vape pens operate at very high temperatures, and leukoplakia. So yes, cannabis's effects on oral health are often convoluted by combining cannabis use, smoking cannabis, with other substances like tobacco and alcohol. But remember, on its own, cannabis can cause a poor quality of oral health, regardless of whether the patient smokes tobacco or uses alcohol. And that's why, again, as hygienists, dentists, dental assistants, we need to be on top of everything that cannabis can cause as far as potential problems with the oral cavity, because, again, cannabis can have both direct and indirect effects on dental treatment planning. That's it for me, again, my friends, this last episode of Fast Facts Pharmacology. Tune in next time when we talk even more about cannabis and its effects on oral health as well as dental treatment planning. This is Tom Viola from Pharmacology Declassified signing off. Be well.
Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.